Hello, everyone. This is Raj, physical therapist. Um, Dr. Ryan Perron, physical therapist, is also with me today. He will be on in a minute. And today we have some questions from Senior Citizen Wellbeing Group. Several people posted general questions. These are not really treatment options. These are treatment options, but not specific to your condition. Whatever we are going to discuss today is very general and should not be considered as we are giving specific treatment to one person or other. So these are general. We are generally providing the information. We will include some medical information that's available online, and as if we are Googling and trying to get some information, we are going to share that information with you. But this is not treatment information to your condition, even though you asked this question. So this is just sharing information to give you more relevant information that you can probably use, or talk to your physical therapist or doctor about this. So one of the questions that it was asked by Zubeda Rezvi. Sorry if I mispronounced your name. And Zubeda, you mentioned about neuropathy, physical therapy for neuropathy. To answer that question, there's no specific treatment for neuropathy in physical therapy. However, there are some techniques I can suggest you can try. You can use ice cubes, use ice, and peripheral neuropathy is usually in the feet and hands. So uh, the treatment is kind of, you if it is painful, the first treatment is medical treatment. Obviously you might have tried some medical treatments. You can use some painkillers, um, or looks like I just searched on Mayo Clinic has some good information about peripheral neuropathy, and you can look into this information. Looks like pain relievers, anti-seizure medication, and topical treatments like lidocaine cream will help, and antidepressants. I didn't know about this one. Looks like antidepressants will help with peripheral neuropathy. But this is the information I'm gathering from Mayo Clinic. So you can also look into this article on Mayo Clinic, or just Google it. As far as physical therapy, as I said, you can use ice cube unidirectional. So you're using it on hand. You go start at the you know tip of the fingers, and you do the ice massage, kind of like go towards shoulder, um, as far as where your pain is, and only one direction. You don't go back towards the tip of the fingers. You come from tip of the fingers towards the shoulder. And the same way, if you're using it on your toes, start at the toes, go towards knee and hip, as far as you feel you lost sensation. It's only unidirectional. The point is to stimulate those nerve endings. That's the only point. Some people don't feel anything initially, but as they keep using this technique for some time, they may start feeling some sensory feedback. So, which is exciting, even if there's no feel, and if you start feeling a little bit ice, or even a mild stimulation, that will be great. That's one thing I tell my patients. The same technique, you can use different textures. You can take some soft cloth, or some rough textured cloth, and use the same technique, unidirectional sensory stimulation. That seems to help some people. There's no guarantee. This is just a technique that I learned from treating patients. And there is anodyne therapy. It's a light therapy. You can Google it. Anodyne therapy is it's a red light therapy. You place those anodyne electrodes on your legs. It's yeah, I think the machine itself is expensive, so I don't know. I don't suggest it. You buy it, but there are some techniques that may or may not work. Um, so those are the few options I can think of. So ice, different textured material you can use unidirectionally on your periphery, on your arms, starting from the tip of the toes or tip of the fingers up towards proximity. So I'm going to let Ryan cover the next topic. Hey, Ryan.
Yes, we've got
Okay.
Ellen. Hello.
You
Yeah.
are.
Okay. Yeah, I have a question from Ellen. Um, Last name starts with a K, and she was asking about sciatica. And so, what we know about sciatica, it's a nerve that comes out of the spinal cord down in the lower back, and sometimes when that nerve gets irritated, whether it be a bulging disc or a narrowing of the opening that the nerve comes out of, it irritates it. It sends sensations and pain down the legs, especially in the buttocks, and goes down the back of the leg. That can be a cause. Another cause that's known as a tight muscle deep in the buttocks that's irritating that nerve. And it can be painful, it can be debilitating. And so, some of the things are to treat that is probably one of the best things is being aware of what might be causing it. Sometimes it's an occupation. People that sit down a lot um, will have that symptom as it puts it in a position where it irritates that nerve. And so, if you're in a job or you happen to be sitting a lot, at a desk or a couch or even driving, might want to have to kind of intervene with getting up and moving around a little bit. One of the things that we do that helps with is heat to kind of help the muscles relax a little bit. If it's pain coming out because of a stenosis, which is a narrowing of the opening, we want to help open up that opening. And so positions kind of like bending forward a bit can help relieve that symptom. But if it's a bulging disc, then bending forward is going to irritate it more. So that's where the help of a physical therapist can come in and say, okay, there's certain movements that will help, and then certain movements, even if it's the same one, depending on the diagnosis, will irritate it more. Um, so if it's coming from the back, there's certain movements that are appropriate and not, but that will be a physical therapist to help you guide you in that. Another one, if it's in the buttocks, the pain, what I suggest is getting like a tennis ball or something, and you sit on it right where it irritates you in the buttock. And just by sitting on that, you're actually putting pressure on the muscle, and that muscle feeling that pressure for about 30 seconds or so starts to relieve itself, starts to release, and that can release that irritation on that sciatic nerve. But one of the more important things we want to make sure is whatever is keeping us back, make sure it doesn't keep the rest of the body from being active and moving and that. And so that's what I've got on sciatica.
Okay, great. Um, the Another question was asked by Olga Beldia. Sorry if I mispronounced the name again. We have people from different parts of the world, and all these names. This is a great learning experience. We are learning, interacting with so many different people, and learning so much. So we appreciate your participation in these Facebook group and videos and everything. We really thank you for asking questions and all the comments and responses. We really appreciate it. And Olga asked about insomnia. Is there a treatment for physical therapy? Um, Physical therapists are more holistic. We cover so many topics, but for insomnia, there's no physical therapy treatment in general. There may be research going on, but I do not know of. But I see patients, and I can share my personal experience treating with if somebody comes to me and tells me about insomnia. uh, my knowledge talking to other patients is and also learning from the articles is, first of all, you have to avoid sleeping during the daytime. And that's the first thing. So if you sleep during the daytime, your body is not tired enough to sleep at nighttime. So going to bed early is another tip I receive. And also, when I was living in India, we used to have fluorescent lights which are bright white, and I found out that it's not good to use white light in the home, especially in the evening time. Use something like the bulb, which is like not the fluorescent, but it's more creamy color, slightly yellowish, color. That seems to help you produce melatonin, I believe. If you have bright light, your body thinks it's not nighttime yet. So you have to use different sorts of different lights. You can look into the light therapy. There are so many different types of light therapies and sounds you can use to go to sleep. It's all about melatonin production in your body. So if you're excited too much by watching videos or things like that, that will decrease the production of melatonin, um, which will keep you awake for a longer period of time. So those are some tips that I understand, and I looked it up on Mayo Clinic. Suggests that you can do, if it is chronic. Obviously, the ones I told you are general and very mild, may work for milder conditions. But if you have severe insomnia, you need to see obviously a doctor and get some proper treatment. And also, there's a cognitive behavioral therapy for insomnia. So you can see a psychiatrist or psychologist. Maybe they'll be able to give you some information better than a physical therapist. But there are definitely treatments you can try, prescription medication, over-the-counter sleep aids. Melatonin is obviously one that I hear a lot, and also valerian root. It's a herbal extract. You can use it. These are all the options that we are just giving, not for your condition, Olga. I mean, you need to figure out how severe your condition is, and then talk to the doctors about it. And as a physical therapist, I would say you need to feel fatigued, tired by the evening. So what are you doing during the daytime? We don't know many things to discuss about your conditions in specific. So if you're older person, really, I mean, like, you still need to figure out how to improve your activity during the daytime. And once you do that, that's only one part of the equation. There are so many things you need to straighten out. Are you stressed out? Why are you stressed out? So how to decrease the stress? Are you working, staying active during the daytime, not sleeping during the daytime? All these are so many different factors you need to look into. Hopefully, I gave you some information that may be helpful to improve your situation.
Great. Yeah. Thank you. I think also on top of that, what's helpful too is if you are sleeping in the day, I tell my patients just get a timer that you just take a 15-minute nap. Call it a power nap, and then, you're just trying to stay awake, but just short naps in the day and, getting that cycle back. Question we have from Dr. He talks about suffering from paralysis. And so I think that's the information we've got, but I think we're talking about a hemiparalysis here. That's the weakness on one side of the body that could be a result from a stroke in that. If for one general information that's helpful, if anything noticed in anybody signs of stroke, get help immediately. That'll help get better outcomes following that. And then once that first 6 months that you are working on it and working hard, that's also the better outcomes you'll get too. So if any of you or someone that just recently had it, just work as hard as you can those first 6 months, and then you can build on that after that. So one of the important things that I do as a physical therapist with those that have one-sided weakness is educating them on not neglecting that. So, because it doesn't move very well, we don't want to use it as much. It's weaker, we tend to use it less. So, need to put the time into exercise, give it the attention it needs. And one of the better things to do is the weight bearing on it. And so, a good one that we do was getting on the hands and knees and then just shifting the weight towards that side that's weak and kind of going back and forth and repetitively getting into that position where it's increasing its tolerance to bear weight. And then when it's safe to be in a standing position, shifting the weight from one leg to the other leg. And then while you have your hands on a table or a chair, the back of a chair, and then also putting weight into the hands. And that helps the joints to get that sensation, and those joints feeling it causes the muscles to react, and those muscles react by stabilizing. And so that's more of the things that we want to get those muscles to do is to get back their stability, and that's called a synergistic contraction of that muscle. And then also range of motion too is an important one, and there's all kinds of ways to do that, using someone to help you to move your joints, your shoulders, elbows, hips, knees. There's a pulley system that you can put on the door where one hand pulls it down and it lifts the other hand up and down. It's a lot of work, but it's worth it. And appreciate the question that you had there, Donham, and hopefully we are able to address it. But if there's anything else, please let us know.
Yeah, obviously, what we are answering is very general. Dr. Ramji, I know you wanted a physiotherapist, but we do not have any resources to suggest a physical therapist. Maybe in the future, if we build up this group and connect with different clinics in different parts of the world, then maybe we can suggest you go to this clinic. But at this time, we do not have any chance to give you any recommendation to go to this or that physical therapist. So you have to find a local physical therapist that can help you with treating paralysis. The next question I got is from Belisa Squillace. I'm sorry again if I mispronounced that name. And the question is about severe stenosis in my neck. What to do? What do you suggest? Spinal stenosis is a severe, especially if it is severe, the pain will be excruciating I'm actually currently seeing a patient that has excruciating neck pain that goes down the shoulder to the left. And first day when he came, I told him the first thing, I mean, especially if it is early stages, like if it started few weeks ago, I tell them to restrict the movement initially. You always, I mean, I wouldn't recommend restricting movements for everybody, because you need to move your joints frequently to avoid stiffness. But if your pain is like 8 out of 10, my goal would be to decrease the pain to below 5. The first thing, I won't have them do any exercise or anything. I tell them how to take care of the pain first. So I suggested getting a collar, a cervical collar, neck collar. He got it and used it for 3 days, and he came back to me and he said, wow, my pain has decreased to less than 5 out of 10. So that's one simple technique: decrease the pain from 8 to less than 5, 4, close to 4. See, that's the thing. So, and another thing I would suggest is, initially, if your pain is severe, take pain medication. Don't hesitate to take prescription medication. A lot of people tell me, oh, I don't want to take hydrocodone, oxycodone. That's not right. When you have severe pain, you must use what your doctor is prescribing. Don't make self decisions not to use it, because if your pain, you can manage your pain, then you're not functioning. That means you're losing strength, you're suffering more, you're cutting down all your activities, which is not good for your mental health or physical health. So you need to try to maintain your daily functions and take care of the basics, socialization. If not, at least to the best possible level, you should maintain your socialization and taking care of your daily activities, and maybe minimal taking care of errands outside the home if possible. I mean, my point is, you need to try to get back to that as soon as possible. So take pain medication as prescribed by your doctor. And those are the two: restricting movement initially, and using pain medication to bring the pain down to like 3 or 4. And then I start working with my patients on some exercises, simple range of motion exercises. Especially with stenosis, you will have pain going, lifting your head up. Spinal stenosis is extension of the movement will be very painful, like pins and needles, sharp shooting pains. So treatment, following your doctor's prescription is the best thing initially. As you build your once you learn to manage your pain, then you work with a physical therapist to try to strengthen your neck muscles, and to improve your daily mobility and function, getting back to your work or doing your activities on a regular basis. um, I also suggest using ice pack over heating pad initially. If the pain is severe, I would suggest not to use heat, because ice is a natural anesthetic. So take a nice big ice pack and wrap your neck, as much as possible, and cover the shoulders if possible. So that's a good way to keep the pain down. Ice pack will be great. TENS unit, TENS units, it's called TENS, TENS, transcutaneous electrical stimulation. So TENS units are very cheap nowadays. You can get it for $20, $30, and they work really great. People don't know about it, and I show these simple things to my patients, and they appreciate me so much that they're able to manage their pain well. using ice pack, TENS unit. Those are the two main things you need to manage your pain. But that's not a treatment for stenosis, though. That's a treatment to reduce the pain, reduce the symptoms. That's all. You still need to work with your physical therapist to get strength in your muscles, neck muscles. There are so many different exercises. I think I covered it in previous videos. If you can look into neck exercises, you can use hands to strengthen. You can use therapy bands to strengthen your neck muscles. So there are so many different techniques, and I would, see a physical therapist if you have. I think at least to get some exercises, you need to see a physical therapist. They will be able to assess your situation, what's your range of motion, what's your strength in neck muscles, and how to take you to the next level, step by step. So hopefully that is, I know I gave you a lot of information, but if you have any questions, you can message us. We will respond back to you. But if you're posting publicly, we can't answer specific questions related to individual persons. So if you message Ryan or myself or Swati, we can respond back to you specifically. But again, you can't take that as a treatment. You still need to see a local physical therapist to be safe. Whatever we share is more generalized, and we want to help you, but we don't want to misguide you because we are not seeing you personally or assessing your situation. So you still need to see a local physical therapist for proper treatments. And I think that's it for today. So we had 5 questions from the group, senior citizen well-being group, and hopefully this information is helpful. And I see another comment here, Facebook user, very super work, information, yeah, something. So they're appreciating what we are doing. Thank you so much. I don't know who the user is, but in StreamYard, I can't see it. But yeah, thank you so much for your appreciative words and comments. Please, if you're watching these videos, please post where you're watching from. And if you're watching it on YouTube, subscribe. If you're watching on Facebook, just like and follow us. Thank you so much for your support, and we appreciate your support.
Thank you.
Bye-bye. Thanks, Ryan.